My name is Laquita Lee, Chief Operating Officer and Lead Medical Assistant here at the Pareto Clinic.
I'm Jeanette, a student here at Edward Waters College and volunteer here at the Pareto Clinic.
Today, we're going to be informing you about the differences between bacterial vaginosis and yeast infections.
Bacterial vaginosis, commonly known as BV, affects women ages 14 to 49. This is an overgrowth of bad bacteria in the vagina.
Yeast infections are an overgrowth of yeast within the vagina, most commonly affected by women who have reached the age of puberty and beyond.
Symptoms for BV and yeast infections can be similar and hard to distinguish from the two.
Bacterial vaginosis is an excessive amount of Gardnerella vaginalis or Prevotella bacterius. Symptoms of BV include vaginal itching, whitish colored vaginal discharge that can also be accompanied by a fishy odor.
Yeast infections are an excessive amount of Candida fungi. Symptoms of yeast infections include itching, vaginal soreness, and vaginal burning. In most cases, yeast infections produce discharge that is white or grayish in color with the consistency of cottage cheese with no odor. What can a doctor do for me that I can't treat this at home?
Although you can treat BV at home, visiting a doctor is always recommended. It will help to treat your symptoms much quicker. Physicians will conduct a vaginal swab. From there, a whip test may be performed. They are looking for abnormally colored discharge as well. Often, BV is treated solely from the symptoms that the patient presents, as these symptoms are distinct to BV. From there, the appropriate antibiotics will be prescribed.
Treating yeast infections at home can be more challenging and can often be misdiagnosed. Physicians can perform a vaginal swab. From there, antifungal medicines will be prescribed and your symptoms will be treated much quicker.
Bacterial vaginosis and yeast infections are both very common. Luckily, there are a few ways to lessen the chances of contracting them. For starters, limit your sexual partners. Bad bacteria is often contracted from the penis and/or sperm. Hygiene is also an important factor. Practicing good hygiene can limit your exposure to these illnesses. Bathe every day without the use of harsh soaps, as well as make sure to change wet undergarments as soon as possible.
Be sure to urinate and bathe properly after receiving oral, vaginal, or anal sex. Drinking at least 64 ounces of water daily is a great way to flush the bad bacteria out of the vagina. So, how can the Pareto Clinic help you?
Here at the Pareto Clinic, we will assist you by providing the right prescriptions to treat your BV or yeast infections. We also offer exceptional in-office care while conducting in-house labs such as urine tests and pap smears.
Wow, the Pareto Clinic is the place to go when in need of BV or yeast infection help.
Definitely. Come see us here at the Pareto Clinic, where we like to say faith,
Leadership,
courage,
wisdom
leads to
success.